Hello everyone. Today we are going to discuss about cancer cervix. Risk factor for cancer cervix is HPV 16 and 18. HPV 16, 18. 16 is most common. Now we are going to do cervical intraepithelial neoplasia CIN staging. That is CIN staging. Remember CIN 1. If dysplasia involves less than one third of the epithelium, if less than one third, it is CIN 1. If CIN in CIN 2, there is more than one third and less than two third of dysplasia. Less than one third is CIN 1, more than one third, less than two third is dysplasia of like CIN 2. CN 3, more than two third and less than whole epithelium. More than two third to whole epithelium, it is in 3, CN 3. Now CIN in situ, CIN in situ, carcinoma in situ, whole epithelium but basement member of epithelium is intact. Whole epithelium is involved but the basement membrane of epithelium is intact. Okay. Invasive cancer. Now talking about the invasive cancer. If basement membrane is broken and dysplasia invades outer epithelium. Dysplasia invades outer epithelium. Very, very good. Okay, chalo. Next one is new classification by Bethesda. CIN key new classification by Bethesda. Guys, remember CIN1 and CIN1, CIN2, 3 and in situ ka alag se. CIN1 is LSIL. Remember, low grade squamous intrathelium lesion. Low grade squamous intrathelium lesion. Intraepithelium lesion. Guys, remember CIN1, CIN2, 3 and carcinoma in situ. It is HSIL. High grade carcinoma in situ. High grade carcinoma in situ. Remember, most common symptom of carcinoma cervix is irregular bleeding per vagina. Yes. Most specific symptom is postcoital bleeding. Yes, guys. Postcoital bleeding is most specific symptom. Most common symptom for carcinoma of cervix is irregular bleeding per vagina. Yes, screening test is pap smear. New pap smear is by cervical brush plus liquid methanol. New pap smear by cervical brush and liquid methanol. Most common fixative. Remember, guys, most common fixative is 95% ethyl alcohol. 95% ethyl alcohol. Yes. In rural areas, there is a technique used for pap smear is Willi and Via. Willi stand for visual inspection with Lugol iodine. Visual inspection with Lugol iodine. Now, Via stand for visual inspection with 3 to 5% acetic acid. Visual inspection with 3 to 5% acetic acid. Management of carcinoma. Remember CIN1 observation for 2 years. If does not regress, cryotherapy. You have to observe for 2 years. If does not regress, you have to do what? Cryotherapy. CIN2, CIN3. Remember LEAP. LEAP stands for loop electrosurgical excision procedure. Loop stands for loop electrosurgical excision procedure. Recurrent CIN1, CIN3. It is hysterectomy. If CIN1 extend laterally, remember L say laterally, L say laser we have to use. If CIN1 extend laterally, then it is laser. Now it's staging of carcinoma of cervix. Okay, according to the spread. Remember stage 1 itself divided into A and B, and A is divided further 2 parts, B is further divided into 3 parts. Remember, A1 is 0 to 3 millimeters. A1 is 0 to 3 millimeters. A2 is more than 3, less than 5 millimeters. So A1 is 0 to 3 millimeters. A2 is more than 3, less than 5. More than 3, less than 5 is A2. Stage 1B, which is further divided into three parts. Remember, B1 is more than 5 millimeter, less than 2 centimeter. More than 5 millimeter, less than 2 centimeter is B1. More than 2 centimeter, less than 4 centimeter is B2. More than 4 centimeter, again it is B3. So B1, 5 mm to 2 centimeters. B2, 2 centimeter to 4 centimeter. B3, it is more than 4 centimeters. Yes, stage 2. Remember, it is further divided into two parts, A and B. Remember guys, upper two-third of vagina is involved. Upper two-third of vagina is involved in A. A is further divided into 2. Size of cancer is less than 4 centimeters. So 2A1, size of cancer is less than 4 centimeter. 2A2 is more than 4 centimeters. Yes. Now B. So upper two-third of vagina plus parametry. ठीक है? Upper two-third of vagina plus parametry was also involved in stage 2B. Now coming for the stage 3A, B and C. Stage 3A, lower one third. Now it is lower one third. Stage 3B, it is lower one third of vagina plus extension to pelvic wall. Take care, extension to pelvic wall. C is further divided into two parts, C1 and C2. So C1 is pelvic lymph node and C2 is para-aortic lymph node. Para-aortic lymph node. In endometrial cancer also, C1 and C2 are pelvic lymph node and para-aortic lymph node. Remember 4A. 4A, it is regional metastasis. 4B is distant metastasis. Remember guys, once more. Stage 1A1, 0 to 3. 1A2, 3 to 3 mm to 5 mm. B1, stage 1B1, it is more than 5 mm, less than 2 centimeters. Then stage 2B2, more than 2 centimeter, less than 4 centimeters. Then it is 1B3, more than 4 centimeters. Okay. Then stage 2A, 2B. Stage 2A and B, both upper two-third of vagina is involved. Upper two-third of vagina. What we have to remember here is A is further divided into two, A1 and A2. Size of cancer is less than 4 centimeter in A1. Size of cancer is more than 4 centimeter in A2. Okay, rest everything is same. Then 2B, again upper two-third of vagina is involved. Okay, plus parametry is involved. Then 3A, lower one third. Now lower one third is involved. 3B, lower one third again plus extension to the pelvic wall. C1, C2, again pelvic lymph node and para-aortic lymph node. 4A, 4B, regional metastasis, distant metastasis. Very good. Management for the 1A. Stage 1A, if it is nulliparous, then you have to do radical tracheostomy. Okay. If it is multiparous, you have to do Vardium hysterectomy. If 1B1 nulliparous, you again have to do radical tracheostomy. Okay, radical tracheolectomy. Okay, if multi, you have to do radical hysterectomy. 1B2 radical hysterectomy. So see, radical hysterectomy. 1B3, it is chemoradiation. 1B3 is chemoradiation. 2A1, guys, remember for the stage 2A1, if the size is less than 2 centimeters, then in nulli you have to do radical tracheostomy, and in multi you have to do radical hysterectomy. So radical hysterectomy is a main treatment here. Okay, if size is more than 2 centimeter, less than 4 centimeter, you have to do radical hysterectomy again. Okay. Now, 2A2, you have to do chemoradiation. You have to do chemoradiation from 2A2 onwards. ठीक है, from 2A2 onwards you have to do chemoradiation. Prevention by vaccine. So carcinoma cervix can be prevented by vaccine. Remember Cervarix. Cervarix is for the strains 16 and 18. ठीक है. Gardasil, more advanced Gardasil, it is for 6, 11, 16 and 18. Remember the best time for it is 11 to 13 years of age. Contraindication is pregnancy. Very, very important. Contraindication is pregnancy. Thank you so much.